So, a very good evening to all of you. To mark the International Women's Day for the year 2026, we have all assembled here. We'll start the proceedings with prayer.
Volume mananaka.
Mami dhanvantari tapata padmam loke jararubhe mrityunasham dataramisham vidaushadhinam sarve bhavantu sukhinas sarve santu niramaya sarve bhadrani pashyantu ma kaschid dukkha bhag bhavet. Om Shanti Shanti Shanti. I now invite our MD of Sri Rajashyamala Ayush Vaidyashala, Mrs. Dr.M.Harikrishnan, to give an introductory speech for the day's event.
Hi, happy Women's Day to everyone. I'm Dr. Krishnan, and I'm delighted to join this online discussion with you to talk about, as a woman, how do we navigate the health through different stages of life. I run Sri Rajashyamala Ayush Vaidyashala Ayurvedic Clinic in Besanagar, above State Bank of India and is in 2nd Avenue. I'm incredibly grateful to Dr. Harikrishnan for his partnership, and with his support, I'm able to pursue my passion for patient care and to manufacture authentic Ayurvedic medicines under the brand Heavenly Fuel, and is being formulated strictly adhering to traditional Sastric texts. So Dr. Hari is taking over from me to present today's topic, Health for Her, an Ayurvedic Women's Day special. Thank you so much. What happened? Dr. Hari?
Doctor, I think you're on mute.
Yes.
Sorry. So, once again, a good evening to all of you. Very good evening to all of you. And I really appreciate your decision to stay with us today for a 1 hour in the midst of a Sunday evening and your other celebrations with regards to International Women's Day. We had initially gave a lot of thought about how to name this program, but Health for Her was very simple, and that's why we thought go out with this topic. And so Jantunam Narajanma Durlabham, that is a very famous Sanskrit saying in our ancient texts. So what does this mean? So we know there are about 84 lakh species in this world which are going through the birth and death. It's a cycle. But among that, the human birth is supposed to be the best, and it is very tough to get that. And for that, who is more responsible? Who takes up that responsibility? It is a woman. So that is an important reason for which we have to celebrate women. But is that the only reason for which we need to celebrate women? Not exactly. There are other references too in our texts. So Lord Krishna in Bhagavad Gita says, I am the glory, prosperity, speech, memory, wisdom, courage, steadiness, and forgiveness among all the feminine principles. So this is a super statement from him. And in other references like Manusmriti, which talks a lot about how to live a dharmic life, highlights how important a woman is for a family. So a family's joy is dependent on her. The family thrives on her. So if there is no presence of woman, then the impact is definitely not on the positive side. So in Devi Mahatmyam, which is another important textbook, where it is said that the incomparable radiance that was born from all gods and pervaded all three worlds, it took the form of a woman. And as always, Chanakya Sutrani, Chanakya Nidhi, it is said that there is no jewel like a woman. So with this as the basic foundation of this presentation, we move forward. In Ayurvedic texts also there are some references, but before that, let us find how important a woman is, how many examples we have in our texts and in our history. So she is always associated with Shakti and Dharma. So it doesn't necessarily mean that only motherhood is something which is going to give her identity. It's not so. So for intellectual aspect, we have a scriptural example like Gargi and Vachak Navi. So she had mastered Veda and she was very great in debates. So spiritually also, we had Maitreyi, devotional, Mirabai, and we have so many examples. So her character, knowledge, and spiritual realization is something which has to be seen. The ultimate respect and liberation are available to women based on her soul's journey and not on her biological output. Even in the texts, spiritual texts, even in the Vedas, it is said that any person who is, whether be a man or woman, if going in the right path of spirituality or self-realization, is eligible to be called as a Purusha, which is the ultimate word in spirituality. So Ayurvedic classical texts, primarily the Charaka Samhita and other texts, they say the female principle as the embodiment of nourishment and creative energy. The woman is said to be the Ida or the lunar energy or Soma, so which governs cooling, healing, and stability. And that's why we find references about how important a woman is for the family. And she is the nourisher, functionally, who supports and carries the world. We know our earth is Bhuma Devi. We call the earth as Bhuma Devi. And Charaka Samhita and other texts also emphasize that a woman must be kept happy and free from stress. So, yatra naryastu pujyante ramante tatra devata. So, the gods will be there only, or divinity exists only when women are honored. But whenever we hear the word women-centric health topics, we just go directly to gynecology topic. We talk about issues related to their monthly cycle, pregnancy, after menopause. All that's fine. Definitely it has to be discussed because those are unique to women and their life is impacted by issues related to gynecology. But there are unique aspects related to other systems also. When compared to a man, woman goes through a lot of other aspects with regards to digestive system, nervous system, musculoskeletal system, and so on. So a woman's gut is actually longer. So the transit time is also longer. That's why the digestion is slow. And because the shape of the pelvis also makes the colon to be much lengthier, the gut to be much lengthier. Hormonal fluctuations will affect their gut movement and sensitivity. The lower stomach acid and slower emptying, these things will cause bloating and nausea. They are more vulnerable to develop these problems. They are more sensitive. The gut is more sensitive to stress. As compared to a man, a woman will definitely develop digestive disturbance in moments of stress, which we have seen a lot of examples. In IBS, there are different variants, two types of IBS. One is constipation, other is diarrhea-related IBS. And the women, they are mostly prone to constipation-oriented IBS. And gallbladder stones. It is always said, fat female of 40. A woman in her middle age who is slightly obese is most likely to get gallstones, but it's not so. Even moderately built or lean women also get gallstones these days. So what we can understand here is these issues are common in women because of their anatomical nature of their body, digestive system structure, the stomach emptying, and the bile composition, which is very high in cholesterol, leading to gallstone formation. And in men, the upper part of the foot pipe, that is the lower esophageal sphincter, the foot pipe is more relaxed, but in women it is closing tighter, it's very tight. So these things are making them more vulnerable with regards to digestive issues. In psychological stress and trauma, that can manifest as GI symptoms more readily in women. And the organs in the stomach are also very sensitive. So pain from surrounding structures, for example, if a pain is from the uterus, it may present as stomach pain. and people will tend to think as a digestive issue, but it's not so. It can be vice versa also. So overlapping with gynecological issues is very common in women. So here is a pictorial representation of common problems in women with specific emphasis on digestive system. So pregnancy also, there is acid reflux because of the sphincter issues in the lower esophagus. Chronic constipation is very common in women. And moving on to the nervous system, so they have strong left-right brain connectivity, better integration and multitasking. So this is a positive side of a woman. That is, they have multitasking capabilities as compared to men. Higher white matter volume, better communication between the brain areas. So memory and emotional processing are also much more active. And at the same time, because of the serotonin and its relationship with estrogen issues, they are getting sensitive to stress, anxiety, and pain. That's why the reactivity to pain impulse is more in women. The sensitivity to stress situations also is more. So the hormones, as we all know, estrogen and progesterone, how they influence the mood. So emotional awareness, verbal skills, intuitive processing, these are all their strengths. So neuro problems in women is summarized here, but here, why women suffer from migraine? So that is because of the vulnerability of the blood vessels, which they just expand, and that because of the estrogen role of estrogen, because of hormonal fluctuations, especially prior to cycle, they get migraine, and they are getting this light sensitivity, severe headache, and fibromyalgia, a very difficult condition to treat in women because of the poor pain threshold. And also we find autoimmune diseases very common in women, and neuro diseases like multiple sclerosis, about which we had a meeting last week. So it is more common in women because autoimmune as such is also they are very vulnerable to autoimmune conditions, women. That we'll see when we see about immune system. So women can face an acute injury in a neurological, especially related neurological condition easily. But when it is a chronic problem, then they are really susceptible to that, or they succumb to a chronic problem. That is called female neurology paradox. And the female clock is actually running faster than the male clock, just 6 minutes, but that is good enough to cause symptoms like insomnia, restless leg syndrome, which is very common in them, as compared to a male. And Alzheimer's 2 times more vulnerable in female because of estrogen loss affecting the brain. And multiple sclerosis, as I said, migraine, they are 3 times more vulnerable to develop migraine because of estrogen and serotonin withdrawal. And stroke, the stroke recovery is very poor in females, and because of the hormonal factors in them. Skin. So as we all know, female skin is more sensitive and lower collagen density. The female has higher sweat gland activity, but low sebum production. And rapid collagen loss after menopause, the aging becomes much faster when compared to a male skin. So what happens is women's skin is more sensitive and reactive to men's skin because of this more nerve endings in their skin. So the nerve endings the distribution is more, 50% more in women when compared to men. That leads to more sensitivity. And pH level is slightly higher when compared to men. So these differences are the main reasons for women to become more prone to environmental damage, pollution, and also reactivity to allergens, irritants, etc. So skin threats by different phases of life we have seen here. So acne we find, pregnancy we find stretch marks. That is again because of the hormonal reason. High estrogen and physical skin distension. Menopause, the skin becomes dry because of collagen loss. It becomes thin and extreme dryness. And across all ages, women are more susceptible for contact dermatitis because there again, the immune system is very sensitive in women. That's why this contact dermatitis happens. So here you find how much, what kind of disorders are very common in women. Here again, autoimmune conditions like lupus will be very common in women because autoimmune as such is very common in women. So musculoskeletal, here we find women to have low muscle strength and low muscle mass as compared to men. So what happens is they have smaller, less dense bones and more flexible ligaments. Actually, they have this ligaments are more elastic, so they become hypermobile. So these days we are seeing more of this anterior cruciate ligament, this knee joint. There's a ligament called ACL. So that ligamental tear is very common in women, even the ankle joint for that matter, ankle joint ligament. That is because they go for extreme gym activity or sports activity without gradual increase of activity. They just go do it all of a sudden, go for dance practice or something like that, or they wear very tight clothes. What happens is it can stretch the ligament and that can cause ligament tear. And at the same time, their muscles are more fatigue resistant and they recover faster. So what happens is due to hormones like relaxin, the flexibility and laxity of joints becomes more. They become loose, and so that can injure the joints because of the associated ligament being hyperstretched. So they have more body fat and different muscle metabolism, which can make them endure better, but they have less power output than men. The muscle tone and power is much less, but endurance is very good. So these are the conditions. We all know that after menopause, women have the tendency to develop osteoporosis. We all know how much common rheumatoid arthritis is in female, 3 times higher than male. Osteoarthritis is significantly higher. And this carpal tunnel syndrome, of late it is again increasing. Earlier, what happened was people who used to drive two-wheelers, they developed this problem. But now what has happened is because of the use of mobile, large display mobiles, they use single-handedly, and use of the thumb and the fingers to hold it for a long time, it causes unilateral carpal tunnel syndrome. Usually carpal tunnel syndrome comes for both the hands because of the acceleration and the usage of hand gear in vehicles. But now the picture is changing because of the use of mobiles. And fibromyalgia, see, up to 7 to 9 times higher than in men. So the pain processing and nerve sensitivity is more in them. That's why they have higher chances of developing severe forms of fibromyalgia. So there again, a pictorial representation of what we discussed just now. So endocrine system, again, we all know how common issues like thyroid, hypothyroid issues are very common in female, and monthly fluctuations, the changes of estrogen and the peaking of estrogen, the surge, and then coming down, progesterone, all these things will definitely impact them. So women's hormones operate on a 28-day cycle, whereas the men's hormone levels follow a 24-hour circadian rhythm. This is an important thing to note. So women's system go through drastic, rapid changes during pregnancy and menopause, which causes significant hormonal shifts. So stress response, as discussed earlier, they are more sensitive for that. And these female sex hormones like estrogen and progesterone affect immune cell function differently. So because of this, protective mechanism in women is better for acute infections, we'll be saying later on, as compared to men. So this Hashimoto's thyroiditis, even today we saw a patient of about 19-year-old girl who had come with this autoimmune thyroiditis. It is very common in females, 7 to 10 times higher as compared to male. PCOS, which causes insulin resistance and hormonal feedback loops. And then pituitary adenomas are not very common in India, but it is tabulated here. But type 2 diabetes, but it is equal as far as diabetes is concerned. It is equal in male and female, but the higher cardiovascular disease risk is there in female. So this hypothalamic pituitary ovarian axis is something which needs to be taken into account, and that can impact multiple glands and cause type 2 diabetes in the long run. So this mental balance in Ayurveda, we call it as sattva, mind is sattva. So if this is in a balanced state, in all issues related to this gynecology, endocrinology, these things can be brought under control. So that's why always Ayurveda gives emphasis to sattva vajaya, or bringing the mind under control and pacifying the agitated mind, or motivating the depressed mind. So gestational diabetes, mostly women who develop this high blood sugar during pregnancy, they are more vulnerable to develop cardiovascular issues during post-menopausal stage. So they have to be careful about choosing the right kind of lifestyle and diet. And so immune system. Since we saw that immune system impacts the diseases of skin, thyroid, neuro aspects, as well as musculoskeletal system, immune system is something which needs to be looked much deep into. Because of this double X chromosome in female, they have this boon of getting better defense against bacterial viral infections due to higher estrogen and 2X chromosomes. But it becomes another problem. They are more prone to autoimmune diseases. Almost 80% of autoimmune diseases are in women. So the adaptive immune response is good, but autoimmune mean what? The body's immune system acts against its own cells, own healthy cells. So that is the risk which they are prone to. So this self-goal, immune system chance of self-goal is high in female. This, as far as the women is concerned, double-edged sword. Immune system is a double-edged sword. So robust immune response to infections, but more vulnerable to autoimmune diseases. So cardiovascular system, the women have smaller heart, smaller coronary arteries, and thinner ventricles as compared to men. The heart beats faster, but in women, the amount of blood pumped per beat is more in men, but it's less in female. And women have fewer red blood cells, which means the oxygen carrying capacity is also low. Estrogen, which reduces after menopause, it makes the woman susceptible for cardiovascular disease. And then women, they have, we all know major arteries are affected. We all know major arteries are affected, and people undergo bypass surgery. Males, it is very common in males, larger arteries, but smaller arteries are affected in female. The plaque formation is there in female. So rather than just the major arteries. So in females, what we need to know is heart attack is present. It presents itself without the usual symptom like severe chest pain, radiating to the left hand, sweating. Instead of that, what happens is here there is a crushing chest pain. So there is the chest pain aspect is underplayed, not much, but it presents itself as nausea, vomiting, extreme fatigue, or jaw or back pain that we need to take into account. So pregnancy-related diseases will cause, as said before, will cause severe heart problems later on. So because of smaller blood vessels being affected, so tests like ECG, stress test, all will be normal. So we cannot picturize the smaller blood vessel block in the usual tests which are done for the common ECG pattern. We need to go for some other advanced tests. So this can delay the diagnosis, and that can also delay the treatment. There is chance for missing the diagnosis also in women's heart-related issues. So atypical means not the usual cardiovascular symptom, heart attack symptom. Here you find shortness of breath, extreme fatigue, and nausea or indigestion. Even we have heard recently about a woman who had just returned from outside, just sat down and complained of severe heartburn. So she asked for water. So the helper went and brought back water, and by the time she collapsed, she had a massive heart attack and she collapsed. So that in that way also it can present. It's not meant to frighten you, but most common is the gastric symptom, but it can also present in this fashion. The other deeper causes can also present as a gastric problem in women because of the structural arrangement in women. So respiratory system, again, here also they have smaller lungs, narrower airways or the respiratory tract. So lung capacity is also low, vital capacity is also low. So whatever air has been breathed in, it entirely is not breath, expiration doesn't bring out everything. there'll be something retained inside. But that residual volume is also low in women. So the respiratory flow rate, expiratory flow rate is also low as compared to male. So the volume which can be held inside is also low. Thoracic, usually women breathe through their chest, whereas men, they breathe using the diaphragm, or abdominal breathing is very common in men. It's very prominent in men. So this progesterone can also influence ventilation, and it can increase respiration rate during the luteal phase of the cycle. So because of these reasons, because of the structural arrangement, smaller structures and narrower pathways, women are more susceptible to some types of respiratory conditions. And sensitive nature of the lungs also will become a problem. So asthma, chronic obstructive pulmonary disease, and then this LAM is a disease where some estrogen will cause abnormal cell growth. This is usually common in the childbearing age. And sleep apnea, about which we all hear very often in women, they complain of sleep apnea. Though it is linked to anxiety or panic, but it is not always not related to mind. Mind can be a trigger, mind can be an aggravating factor, but sleep apnea should also be treated on the lines of asthma in Ayurvedic sense. We need to treat it. We have to improve the prana shakti. We have to ensure the person's mind is calmed. But at the same time, prana shakti is also to be ensured. And though we are not giving a full-fledged treatment of asthma here, we need to do this approach is same as like asthma. So pulmonary hypertension is very common in females who have this autoimmune disease, because the lung tissues will become scarred. They will no longer be functional. So because of the blood pressure builds up inside the lungs. So women are also vulnerable to toxins like kitchen hazard, and because of the capacity is very poor during an exercise, women have to work more hard to achieve the oxygen requirement for the muscles which are involved in the exercise. So this can lead to shortness of breath. So now we are coming to the gynecology aspect of women health, and PCOS, we all know, we not overemphasize. Already people know how common it is. And what we need to understand here is PCOS doesn't necessarily mean woman who is obese and very moon phase and all, not that. A lean PCOS or severe insulin resistance can happen without a high BMI also. The BMI may be near normal, but still the person can have severe insulin resistance in a PCOS female patient, irregular periods, facial hair and thinning of scalp hair, type 2 diabetes and cardiovascular risk, all that will be there. But it doesn't mean that obesity should always be present. But pelvic inflammatory disease is very common these days because of poor menstrual hygiene. And not only that, Ayurvedically interpreting it, this is a pitta related issue. And the choice of food, very spicy, masala, and poor eating habits, delayed eating, stress eating, all these things can precipitate pelvic inflammatory disorder also. So because of which it can cause scarring of the fallopian tube and even ectopic pregnancy. So uterine fibroids, we get a lot of inquiries about whether fibroids are treatable in Ayurveda. So they are all non-cancerous growths, and they are classified under pitta category of diseases, and we treat on those lines. Not exactly like a growth. We don't aim to reduce the growth size of the fibroid. Even modern medicine also, they always say if the fibroid is not very big, and fibroid does not cause severe breathing issues, doesn't affect the cycle, then need not be much worried about it. That's what they say. So what happens is, only the problem is, unless the symptom shows up, unless the patient feels too much of discomfort, they won't come to the doctor. So by the time, the fibroid can enlarge also. So delayed diagnosis can actually lead to diagnosis of a large fibroid. Endometriosis, it is a silent disease. It affects millions, but what happens is there is at least a delay of 7 to 8 years in diagnosing it, because the pelvic pain, which happens during periods, is always thought to be a normal. Okay, it's a period-related pain, let us go through it. But many do not know that it can be due to endometriosis also. And the period pain is dismissed as a normal part of being a woman. And because of that, by the time it is diagnosed, they would already reached the advanced stage. So coming to oncology, these days this topic has to be discussed because cancer prevalence is on the high. So what happens is lack of routine pap smear screening in rural India is one of the main reasons of cancer, like cervical cancer. Of course, there is a lot of awareness about breast cancer. We find a lot of camps being conducted, free camps, breast cancer screening. All this is going on. Ovarian cancer is a silent killer, very severe, but it is not, luckily, it is not very common, but still it is very severe. Thyroid cancer is 3 times more likely than men. And endometrial cancer is very common in obesity or PCOS, in PCOS patients. So here's the presentation of how it is diagnosed and what is the prevalence. So risk factor, there will be a family risk factor for breast cancer. Cervical is more linked to infection, and colorectal cancer, it's because of low fiber and sedentary lifestyle. They always say exercise is very important in preventing cancers, especially colorectal cancer. Now coming to the important point here, as far as the woman is concerned, as we already saw, the circadian rhythm in male is is 24 hours cycle, whereas in a female it is Ritu Chakra, monthly. And major dosha risk in female is Vada, whereas in men it is Pitta, heat. In female it is Vada due to blood loss or cycles and the erratic representation of cycles, and then sudden change of season, sudden change of sleep pattern, stress, all these things are related to Vata. Then suggested detox method is for women. It is always a good option to go for a monthly detox because they represent lunar cycle. Main tissue which is to be replenished from time to time, which is to be healthy always, is the Rasadhatu in Ayurvedic terms, which is the main tissue which nourishes all other tissues. Whereas in male, it is the marrow or the nervous system and the marrow which fills the bones. So because our focus is mainly on women, we are going to see more about women. So as I said, there are 7 tissues in the body. We all have heard about Prakriti. Prakriti is constitution, that is body, mind constitution. When a person is born, his functional aspects are determined. The body's physiology, his overall outlook, his memory, his work capacity, all these things are understood through something called Prakriti or constitutional analysis. Whereas this Saptasara or 7 essence is nothing but each person structurally is made up of one particular dominant body tissue. So that tissue represents their health. If that tissue is very strong, if it is maintained in a healthy manner, that means the person's health will not be challenged much. So in that way, you find that a person who is dominant in skin or tvaksara or rasa, so that is a foundational tissue, as I said before, because it nourishes all other tissues. So they have a healthy lactation, smooth menstrual cycle. So the nourishing energy is good. They are highly sensitive to emotional stress. So that's why they develop this other stress, skin rashes. They are more vulnerable to develop allergic skin reactions, photosensitivity sometimes. People who are dominant in blood, whose body is made up of, they call Raktasara. So good quality of hemoglobin in circulations. When you tell them to just show their hands, you can find their palms to be very red. When you make them stand in front of light, and if you see their ears, and you can see the red light causing red color of their ears and the ear lobes, which means that they are Raktasara. So there is a reddish tint to palms, tongue, and lips. Ears and eyes appear bright. So this is very important for menstruation. And even if there is a blood loss, these people recover from it very quickly. But if they are lacking in it, and the most vulnerable combination is a person who is Raktasara at the same time Pitta, Vata, Prakriti, which means that they will lose blood more rapidly. So in this case, what happens is they cannot replenish very fast. They go into anemia very easily. So they are more prone to Pitta disorders like heavy bleeding. So not only Prakriti, not only Sara, there should be an ideal combination of Prakriti and Sara. Only then the health challenges are minimal. So muscle-based body, they are having good structural integrity and good uterine muscles. Easy labor and the chances for prolapse is also less. They are less prone for musculoskeletal pains and joint laxity, looseness of joints, which are usually coming in old age. No, those things are not there in them because the ligaments are also very healthy in them because of the strong mamsasara or muscle-based body component. Fat-based body, they have good lubrication. Skin is oily, hair is oily, sweet voice, good tolerance. Because estrogen is stored in fat tissue, they have a cushion against harsh symptoms of menopause. So in that way, they are able to withstand that tough menopause phase. But at the same time, they have to be careful with insulin resistance, diabetes, type 2 diabetes, and PCOS because these are also representations of fat tissue and they can get affected much if they are going through these diseases. And then Astisara or bone-based body component, they have large joints, they are usually taller, strong teeth, prominent bones. Osteoporosis chances are less in them because they are basically the bone buildup is very good in them. And their posture is also well maintained. They don't get this hunchback very quickly. They are maintaining erect posture even at the age of 80. So they are called as unshakable in our scriptures. And Majja is bone marrow, or we also say nerve excellence, Majja-based body. They are soft-spoken, but strong frame, though they are thin. And they are highly resilient nervous system. So they are less likely to suffer from migraine or fibromyalgia, which we saw earlier. But very hard to see such people in this geographical location. Majja Sara based people we have seen less in our observation. Next is Shukra Sara, or the people in whom their reproductive fluid is very dominant. For them, even more healthier, and they have bright teeth, gentle behavior, radiant complexion, highly balanced hormonal system. It's not a very fluctuating one, it is very stable. And they are born for motherhood, divinity. They have high fertility and very good ojas. Ojas is nothing but the essence of all the 7 tissues, and ojas quality is very good in people who are born with Shukrasara or this body component. So there is something called Sattvasara. Next one, the Sattvasara is nothing but a person's psychological component is very strong. So they possess good memory, good analytical power. They are steady both even in adversity and even in comfort. They are not easily affected by fear or grief, and they never deviate from righteous living. Their cleanliness both in body and mind, and they also look for service, doing good service to others. Interestingly, what happens here is, even if they have a very poor physical body, because of the strong mental makeup, they makes them to endure pain and hardship, and that would break a physically stronger person also. So that's what we say, the mind is more powerful in these people because by nature they are born with sattva sara. But what we need to understand here is all other things which we saw till now, the 7 tissues, body makeup, that is by birth. But sattva sara can be inculcated, can be cultivated. A person can be made into such a person through sadhana practice, like pranayama, onkara japa, or sattvic ahara diet, karma yoga. It is the basic intention of all the texts which we read, like Bhagavad Gita, is making a person sattvasara. So this is the difference between physical and mental sara. So this source is genetic or maternal nutrition, whereas mental sara is karmic or spiritual practice. So physical one is structural strength, mental sara is emotional resilience, and mental sara is systemic, it governs the entire body. So sarva sara is something, it has the goodness of all the 7 tissue, that is called sarva sara purusha. And here what we find is, it is most ideal, there is no problem, everything is okay about them, but we rarely find such people. Okay, so what is to be done now as a woman? We need to know, women should know their body, mind, constitution, and also the body tissue makeup, that is Sara, which I discussed. They should adhere to Ayurvedic guidelines with respect to dinacharya, which is daily regime, and seasonal regime, that is ritucharya. And diet and lifestyle is to be planned, it should be health centric. Now, when we say health centric, the diet and lifestyle which is advised for prevention of a problem is different, and after a problem has occurred is different. For example, if somebody wants to gain strength before getting diabetes, is not diabetic, she is normal, then we give a protocol. But when already she has become diabetic, then we cannot give sugar based or a sweet based diet to them. For them, then the rejuvenation path is different. So special attention to cause of diseases. So Ayurvedic texts list out this. So it's a small tabulation of what causes, especially the gynecological issues. We have tabulated here. So what we mean, these are all Sanskrit terms. I'm sorry for that, but I'll just explain you in English. So Vata-based problems like pain-related, very severe dysmenorrhea, and dryness, and then unpredictability of cycle. Suddenly it comes for within a short gap. Suddenly it gets delayed. So unpredictability. So and then depletion, loss of weight. All these things are because of very poor choice of food, like very dry food items, and problems like endometriosis, where though there is a growth inside, the presentation is severe pain. So in that case, what we find is women have this habit of suppressing their natural urges like urine and bowel evacuation, all because, and also they are very poor drinkers of water. So water intake is very poor these days by women. And what happens is they have the social issue of choosing the right toilet, and they only use their toilets at home. So what happens is they are bound to suppress their natural urge. This can result in problems in future like severe endometriosis or dysmenorrhea, etc. Then Paitika, Pitta related issues are Amla, that is sour, salty, heat based food, very hot in potency. Like you said, for example, very deep fried, lot of masala, gravy, or dry items, whatever they take, they are going to increase pitta. When red chili and tamarind, tomato all combined together, that is the best example for something which can shoot up pitta very quickly. This can lead to severe bleeding disorders, especially fibroids, and also other gynecological disorders where bleeding is the prime symptom. And kapha related problems, growth of cysts, and then other benign tumors or even larger tumors which can happen to them in the uterine cavity. That can be due to intake of heavy, sweet based, too much of nourishing food items, and very sedentary lifestyle, not going for exercise, sleeping during the daytime. So a combination of all these can cause a complex symptoms as well. Now, what is the way forward? So right now, most of the women, they go for some step towards health purely for the reason of making them look better or getting social recognition, status, and at the same time, they compromise their health for work life and personal issues. They delay taking care of health, saying that let us take care of our health after the age of 50 or 55. Till then, let us run, and let us not think too much about it. But that is not the way to go about it. Better to choose, better to prioritize life which is full of contentment, listening to yourself. Listening to yourself means what is your real capacity. Whether what you're eating suits you, what you're eating, the quantity is correct for you, whether it will fulfill your stomach, or you're going for a very strong dieting pattern where you won't eat for your hunger, but you will eat for your forced weight loss plan. Where so what happens is that will only lead to problems. So you should listen to the woman should listen to herself with regards to the body and mind, and when it is within the scope of achieving health, it has to be adhered to. So only then inner peace can be achieved. So overall, things which change over time, this recognition, this looks, these things keep changing. But what is more important is traveling inward, which can make her feel healthy by understanding the realities of life and its purpose. So I really thank you all for patient listening. And if at all there are questions, I'm ready to answer those and try to answer those.
Doctor, this is Kala here from Mumbai. Can you hear me?
Yes, ma'am.
So it was a lovely speech. We really liked how you described the various disorders, and especially what you talked about the 7
Issues.
in which you can be strong. That was a very new knowledge which we gained today. That was really nice. Just one or two small quick things I want an advice. See, what I find these days is that the young girls now in the reproductive age, they are finding it difficult to conceive. So natural conception has become very difficult these days. So can you give some one or two small lifestyle tips to improve fertility and how to become more easily to conceive, have healthier eggs and things like that?
Yeah. See, as far as the food is concerned, what happens is these days people are going for seedless. Everything is seedless dates, seedless grapes. So our guru used to say, Mahadevan sir used to say, his guru told him that you should take fruits with the seed, like pomegranate, paneer, grapes with seed, and then we should go for food which, like milk, reduce the quantity of milk, caffeine in milk, and go for pure milk, good quality milk. So these are the changes with regards to diet. But with regards to lifestyle, we have this, we are hearing this more often these days. There is the power of manifestation. Anything which is formless, anything which doesn't exist as of now, it is going to exist in the future. That we have to, at the mental level, we have to imagine it happening. And once we meditate, and even see, meditation is not just spirituality, not for just spiritual bliss, but it's also for making positive things happening within us. So that is one important thing we need to do. Meditation, avoiding sedentary lifestyle. The more, we should not be hyperactive. I don't mean to say people should go for gym or go for very strong yogic practices, but consistency, and then listening to our own body, understanding its need, taking care of the Ayurveda says Agni is the main cause of all the problems. So Agni has to be taken care of by giving the right food at the right time. Only then the tissues will start forming. As I said, the 7 tissues will form from the body, the food's essence. So when we take food which is rich in nutrition, not only in terms of protein, carbohydrate, vitamins, but Ayurvedically speaking, which is, we say Sara Bhutam. That Sara is nothing but the essence which goes and reaches up to the level of the 7th tissue. It is the 7th tissue which is designing fertility. So when we channelize that properly, when we take food in that sense, reduce the use of spicy masala stuff, and take more sattvic food, and which has good record of improving fertility. For example, milk itself is very good, which is good for ojas, like ghee, which is good for this jaggery, as we say, not a sakare, we say. So those things can be included in diet. The cause of infertility has to be found out anyway. If it is a vata-related cause, it is a different approach. Pitta-related cause, it is a different approach. Kapha-related, different approach. But if the person has no cause, there is nothing demonstrable. It is only that the pregnancy is getting delayed, conception is getting delayed. Then we have to go for a typical planning, starting from basic addressal of Agni, improving the body tissue by choosing the right diet. Definitely medicines will be needed for this. It's not that medicine, we cannot do without medicine in this case. If the right age is still there, people also expect things to happen very fast. But if they have already crossed the age of 25, I mean married women actually, 25 to 28, then they can go for some corrective action because the sooner they get pregnant, the better it will be for the mother as well as the child in the future.
Thank you, doctor. Thank you so much.
Yeah. Sir, I have a question. With respect to yoga, nowadays women are more, doing yoga than men. Do you suggest any particular asanas that are beneficial for women, or any asanas that has to be avoided by women, according to Ayurvedic perspective?
Ayurveda, we can interpret yogic practices in Ayurvedic manner. Some yogic practices are heat generating. Pitta, they kindle pitta, they kindle appetite. Some yogic practices, they are neutral. Very few are cooling. Those cooling asanas are mostly related to breathing states like Shitali, Pranayama, etc. So Surya Namaskar, we always recommend for women. It's not that they should do 10, 20 cycles, 100 cycles, not like that. Let them do within their capacity. Whatever they do within their capacity is going to benefit them big time. Because, as we said, thyroid issues are very common these days, and it's very common in female. And there's nothing best as compared to Surya Namaskar for them. And if women are going through heat-related, pitta-related issues, then we need to deal that on a case-to-case basis. We have to understand other conditions, assess their prakriti, their capacity, and more often, if they are in the blood-based component and pitta, vata, prakriti, then Surya Namaskar is not practiced very vigorously, not the first choice. Maybe once they get acclimatized to the yogic practice, they can start doing it. But initially, go for milder form of yogasanas like Tadasana, and then they can go for Vrikshasana, basic standing postures, and then they can go for sitting posture asanas like Siddhasana, Padmasana with breathing practice, and then they can then move on to lying down posture with Paschimottanasana, and maybe slowly they can go for Bhujangasana. But the idea here is the body's flexibility should be to be seen. So this Tadasana, Vrikshasana, Padahastasana, these things are easy for all. It's not very tough. Unless they have a spine issue, these things are not going to have much problem.
Thank you, sir.
One question. Is there any signal or alarm that for a person to get a heart attack, sir?
See, heart attack, the classical symptoms, as I said, for women, it may not present with the classical symptom of severe crushing pain in the chest. It can come as a nausea, vomiting, and fatigue also, or jaw pain, or upper back, or sometimes low back pain. But otherwise, the shortness of breath, history of diabetes, it is a general dictum, but we find heart attack coming in young age also, who have no diabetes, no cholesterol, no blood pressure, but still getting it. So mostly what we can say is the cause of these conditions, how it happens, even for a non-diabetic, non-hypertensive patient. That is because of exertion beyond capacity, stress levels beyond capacity, pushing oneself too much, not giving the body its due rest, not taking sleep at the proper time. We find recently we also saw some news regarding children collapsing, falling down due to massive heart attack in school ground. So these things are happening. We should really go for a thorough history of what happened in the background, but most probably it should be overexertion and maybe even physical stress, if not mental stress, even not sleeping properly, or too much of exam stress, or a lot of other aspects like not eating properly, too much of fasting, undernourishment can also lead to heart issues, because Ayurveda says for heart issues, it's not more than the overnourishment, it is the undernourishment, exertion, and pushing oneself. That is the more common cause. These are the more commonest causes for heart attack or heart immediate arrest of the heart. We say Hrid Graha. So we can decode the cause behind. We can avoid the cause behind of heart attack, but the predicting the heart attack exactly is very tough. To be frank, it's very tough. It's very tough to prevent heart attack heart attack by knowing that is immediately. If we know something, suppose somebody is getting chest pain, it need not be heart attack. It can be even due to, we have seen so many cervical spondylosis patients developing upper chest pain, and they are really afraid and they feel as though they have got heart attack. But these are all, we cannot predict it. It's not like a warning sign. But cardiologists usually say severe pain, it can be referred to the right side of the chest also, but most often the left side, which is radiating to the left hand shoulder pain, severe sweating, shortness of breath, sometimes palpitation, faint feeling of fainting down. So all these things they say.
One more question, sir. Do Ayurveda suggest or recommend vaccination?
Ayurveda, there is no concept called vaccination in Ayurveda. Of course, many are doing this Swarna Prashana and all. I don't see any. It's not explained that much elaborately in our textbook about Swarna Prashana. I don't know how many of you know about Swarna Prashana. It's giving a preparation for children during the Pushya Nakshatra every month. Just one drop. It contains Swarna Basma, very low dose. They say it develops immunity. But this, apart from this, vaccination as such is not told in Ayurveda. Our vaccination concept is what? Dinacharya, Ritucharya, adhering to diet guidelines and lifestyle guidelines. That is the way we vaccinate ourselves. Vaccination is nothing but prevention. We don't have anything like against this disease. To prevent this disease, you do this. To prevent that disease, you do this. You vaccinate this. We don't have this concept. We just have overall health. How to, so we say samadosha, samagnishta, samadhatu, malakriya, prasannatma, indriya, malaha, swasthaya devidira. So make sure that the body, dosha, vada, pitta, kapha are doing their normal functions. Your agni, your digestive fire, and the digestive fire which is present in your body tissues is normal. Your body tissues are doing their normal functions. Your body excretion is going normal. Your mind is very pleasant. Your sense organs are functioning very well. So this is the best sign of health. And to achieve this, whatever it takes, like Dhanacharya, Ritucharya, Ahara, Niyama, that you follow. That's all. So vaccination is not there now. But we are not against vaccination right now. There are different schools of thought. People say, even in modern medicine, some doctors say that certain vaccines are causing attention deficit hyperactivity disorder, ADHD, autism in children. There is a lot of debate going on around that. I think that is left to research, but for some conditions, still vaccination is compulsorily done. We have seen children not being vaccinated at all. Even during the COVID, people have not vaccinated them. They have not taken their vaccination right from birth. They are all leading the normal life. So this question has to be answered by a lot of observations, not by seeing one case or few patients. So any more questions, you can just message me on WhatsApp. I have given my WhatsApp number. So we are at Besan Nagar. In case if you need anything for consultation, you can meet us there. And
so Dr. Harikrishnan is available in our clinic for consultation, for further consultation, and he'll be there from Monday to Friday from 11 to 4. So you can fix up an appointment before seeing him. Okay.
Okay. So we shall close the session today. Yes. We'll be meeting, if possible, we'll meet further and we'll announce you before we do some other program. We had a Teachers' Day program before 2 months. During this September month, we had Teachers' Day program. So such things will be happening. We will let you know. So thank you once again. Thanks a lot. We have a YouTube channel, Disease Free World. You can visit our channel also. Thank you, Prabha ma'am. Thanks for your
thank you, sir.
Yeah. Thank you. Wish you all good health. Thank you.